the government has allocated 2.3 billion cedis to the Ghana Medical Trust Fund, popularly known as Mahama Cares, to strengthen the national response to non-communicable diseases. The initiative was established to provide both financial and medical support to Ghanaians battling chronic conditions such as cancer, kidney failure, and heart diseases. Now, the fund aims to expand access to specialized care by covering treatments not provided under the National Health Insurance Scheme, while also investing in critical health infrastructure, medical equipment, and specialist training to address long-standing gaps in the country's healthcare system. Now, presenting the 2026 budget in Parliament, the Finance Minister, Kasiela Toforsin, said the new allocation is expected to significantly scale up the fund's operation and improve health outcomes for thousands of patients across the country. And joining us now via Zoom for more on this development is the Health Policy Advisor to the fund, Dr. Norbert Kipo. Thank you so much for joining us this afternoon, Doc. So, government says it's allocated 2.3 billion cedis to the Ghana Medical Trust Fund. How significant is this injection, at least, for improving your operations?
Thank you so very much for having me. The Ghana Medical Trust Fund was established earlier this year with the sole purpose of mobilizing resources to support the specialized care of patients with chronic non-communicable diseases. And this is government's commitment to support patients who have to deal with the catastrophic cost that comes with non-communicable diseases. Research has shown that not only the individuals, but their entire families, about 75% of them are drawn below the lines of poverty within the first 5 years after a diagnosis.
Right.
And you can all attest to the high cost of this care. When you talk of the cancers, when you talk about kidney care, when you talk about dialysis, it involves so much. The costs are so much. The equipment to manage these diseases in terms of diagnostics and treatments is a lot. So having this injection shows that government is really committed to this cause. It's not just about establishing a fund, but then there is commitment in the form of financial resources to ensure that we are able to reach this mandate of supporting our patients financially. Our mandate goes beyond the financial protection we are giving patients. It delves into areas like equipping our hospitals, because to be able to offer specialized care, you have to make sure that your hospitals are at a level to provide it. Let me give an example of cancer. So when a patient up north is diagnosed with a cancer and has to undergo one of the treatment options, which is radiotherapy, we don't have any machine in the north. So they have to either come to Konfanoche or Kolego. Now, the pressure is too much that sometimes they have to be on a waiting list, sometimes as long as 3-4 months. Having to travel down south also increases the cost of care. So if you roll out a program where you are paying for the bills of patients and they go to the hospitals in the north and they can't access that, then it becomes a challenge. These are barriers that prevent patients from getting it. So once you have this huge injection of capital from government, we appreciate the commitment government is making, and this will go in helping patients access good quality healthcare.
So the Mahama Cares, as we know, it has actually been quite clear on the mandate and then the object, and as well you have just been sharing it. But non-communicable disease is quite wide. You have just been telling me that you're going to be tackling both the front end and then the back end. But specifically for this funding that has been injected, where are you starting from? Is it to provide facilities for hospitals that do not have that facility, or just the funding part of it? And which one of the non-communicable diseases are you starting with?
Thank you so very much. So the mandates go hand in hand. Like I was trying to explain, while you are making it affordable, it's important that it's also accessible. Because if it's affordable and I can't access it, I don't appreciate the affordability of it. And if it's accessible and I can't afford it, then the treatment is there, but I can't enjoy it. So the two must go hand in hand. That is why the huge capital injection is very much appreciated. When you talk about non-communicable diseases, you are right to say that this includes a whole lot of conditions. We have to start from somewhere.
Okay.
And as a new fund, we don't want to bite more than we can chew.
Okay.
So we are having...
Proceed.
So we are having technical engagements with the National Health Insurance Authority, which has already been in existence and offers some protection and coverage for certain conditions. So we are in some technical discussions to determine where exactly they end and where we can come in so that our interventions do not duplicate one another, but then complement to offer a comprehensive health package for all patients.
And that's a good point that you have raised, because the National Health Insurance is quite clear. You have a card, you show it, your service is provided, and it covers. For the Mahama Cares, if a person is diagnosed of a certain non-communicable diseases, where do they start from? Should they be registered? Should they just walk to the facility and enjoy it?
Right. So our bill states the eligibility criteria for patients. So first, you have to be Ghanaian. This is a policy for Ghanaians. Secondly, you have to be registered on the National Health Insurance Scheme. This is particularly important because patients have to go through the systems of healthcare. The Ghana Medical Trust Fund sits at the very top to deal with complex conditions and conditions that pose a huge financial burden to patients. And before a patient is diagnosed with that, most of the time they go through the system. So for example, patients with kidney disease, most of the time would have hypertension, most of the time will have diabetes or some form of conditions that are a risk factor for developing the kidney disease.
Right.
So on the assumption that, say, Mahama Cares is dealing with chronic kidney disease, patients will have gone through the systems of managing their hypertension, managing their diabetes through the National Health Insurance. And once it gets to the level that goes beyond the coverage of the National Health Insurance, then you can be rolled on to the Mahama Cares. Also, for certain conditions, your doctors would have to make an application on your behalf. So that it is reviewed. So conditions like surgeries, one-time interventions, so that it is reviewed, then funding can be made available to the facility for the treatment. So it will come out in two forms, where patients are automatically onboarded based on the condition they have, and the instance where patients would have to apply to the fund, particularly if there isn't any designated benefits package for that specific condition. I don't know if what I'm saying is quite clear.
There's clarity to that, yes.
Yes. And based on our technical discussions, once we are done, we've given ourselves a maximum of 4 weeks. Once we are done and we have all the details, we have the benefits package, we have the costing, the tariffs, the service list, the medicines list, then we hope to onboard at the beginning of next year. The stakeholders will be communicated to, government would be, the people of Ghana would be communicated to. They understand the conditions that are covered. They have full clarity on the process of being onboarded on the Mahama Cares and would roll out in full swing. Like I said, we have to start from somewhere, considering the vast nature of conditions that fall under non-communicable disease. We have to start somewhere. The specific conditions will be listed, and as the years go by, we continue to review. We review, add more conditions, review the tariffs to make sure that they are realistic and actually meet the cost of care that service providers are offering to patients.
Thank you so much, Dr. Norbert Kipo, for joining us on the news today.